Pulsatile are the ones that can be used like the intra-aortic balloon pump, which was, as you know, started in 1960 actually. And then you have the continuous flow pumps, which are divided into axial flow and centrifugal flow. We already talked about the centrifugal flow, but in addition, we've also got these small impellers or small percutaneous heart pumps, which can be placed transcutaneously or through the femoral artery and the aorta into the heart, and they can help offload the ventricle. You can also classify the current mechanical assist devices into devices that support the right ventricle or ones that support the left ventricle. So the ones that support the right ventricle are the impeller RP, the tandem heart, which is the RA to PA, and the ECMO, which is the veno-arterial ECMO. The left ventricular support devices are again the ECMO, the intra-aortic balloon pump, the impeller, which is found in about 3 types, depending upon the liters of cardiac output that it's able to generate, and then the tandem heart. And as we see over a period of time from 2004 till almost recently, there has been an exponential increase in all these circulatory devices. These are our permanent ones. These are our temporary ones, and all of them have exploded and helped assist these patients of acute heart failure. As we know that acute heart failure is a global pandemic. The intra-aortic balloon pump is the first one. Let's talk about that. That was introduced in 1960. And basically, it's a double lumen balloon catheter, which is again introduced percutaneously, retrograde fashion through the femoral artery into the aorta. You have to be very careful in patients with